Thank you everyone for coming. I appreciate you taking time out of your Friday, especially to come hang out with me today. So I'm not sure if you saw like the video they did or the AMA, or maybe you just saw this, but again, I really appreciate you taking the time. So I am actually an alum from the program, so I do have the unique perspective of I was a student over 10 years ago now. I also did my residency program through CU. And then I left, and then I worked at a couple other places and came back. So I do think I have a unique perspective as being a student, resident, working here, and then kind of full circle coming back. But yeah, so I'm an assistant professor here. So I've been here for a little over 3 years. I was at another university, Southern Illinois University, before. So I have been teaching for a while now. And my practice site is the Marcus Institute for Brain Health. So we're a mild to moderate traumatic brain injury clinic. We treat the sequelae of TBI, meaning our patients aren't immediately right after their injury. Usually they have to go to a hospital for that. So usually we require a minimum of 1 year out. I've had patients who are 10 to 20 years out from their injury and are still having issues. So the clinic, I'm there every Wednesday and Thursday. So I'm there 2 days. And we treat veterans, first responders, and elite ex-athletes, mainly veterans. We're about like 85 to 90% veterans. Though our first responders, firefighters, SWAT, CIA, FBI, they're increasing a lot as well. So those numbers may change this year. And then we get a sprinkling of professional athletes that have come through. But it's an intensive outpatient program, so it's pretty unique. We fly them in from their patients from all over the United States. They apply. We fly them in, we evaluate them for 3 days and say, hey, our program's a really good fit for you. Or some patients are like, hey, you have more PTSD. Let's go send you somewhere else first, your treatment for that. And then you can come back for treatment for your TBI or traumatic brain injury. And then if they get accepted to the program, they come back for 3 weeks. So they're here in therapy from like 8 to 5 every day. There's neurologists, there's me, there's physical therapy, there's behavioral health, there's art therapy, there's music therapy, there's speech pathology. I'm sure I'm missing a couple others, equine therapy. So they really do get, we say like 3 to 5 years of therapy in 3 weeks, which is a really cool experience to see our patients in those 3 weeks really grow and just get the treatment that they really need. So yeah, that's one little piece that I do. And then the other times I am teaching classes in the PharmD program. I also teach in our cannabis master's program. So I do specialize in cannabis. And so I teach the special populations. So oncology, we bring someone in for that because that is not my specialty, but children, elderly adults, pain management as well. And then I run a residency program. So I have 3 residents with me wandering around all the time. And then I have 2 fellows. So again, residency and fellowship is the year after you graduate pharmacy school. So you do your 4 years of your PharmD program. And then if you want to specialize, you do a residency or fellowship. Fellowship is more research based. But the fellows, they're neurology fellows. So when they're with me, it's kind of like their clinical time. So they get to see patients. So they get to have a mix still of patients and research. I think that's all I do. I'm sure I do a lot more, but that's kind of the gist. But yeah, I'd love to hear what questions you all have. And before I came into academia too, I was in community pharmacy. I worked at an independent pharmacy. If any of you are from Colorado, Good Day Pharmacy is the group of pharmacies I worked for. I was a clinical coordinator for them. And then I was in primary care before, so at a primary care doctor office. So yes, I'm in neurology now, but I've done a lot of other things too. And, I have a lot of all the professors. I can maybe answer some of the questions too, if you have another interest, but yeah, I think that's the gist, but, yeah, what questions do you all have?
So sorry if you hear something. I'm in the car driving. But what parts of those other things you did, like working in a primary care office, working at an independent pharmacy, what led you to decide that you wanted to work more on the teaching side and also in like a specialized neurological therapy? setting?
Ah, great question, Christine. So I've always loved teaching. I never thought I would be in academia, honestly. But during my residency, I'm the resident director now for we have 3 community-based residency programs. So pretty much you are at a community pharmacy or in primary care. We have a student free run clinic here, you're there. So you're doing all kinds of things, but we do require all of our residents to do a teaching certificate. So I did the teaching certificate here, and then I was able to teach 2 classes, and I really liked it. So I always knew eventually I may end up in teaching, maybe not a full professor, but like as an adjunct. And then, of course, obviously that changed, and now I'm in full academia. And then, so yeah, and I think that just all what's cool about pharmacies, you can kind of pivot really quickly. Like, I've been in community, I've been in AM care, and now I'm in specialty. As a PharmD, you have that baseline knowledge to be able to pivot to different fields, which is really cool. So you're trained to treat all disease states. And then kind of when you're like, okay, now we move to a specialty, you kind of just focus in on that. And so when I kind of switched from primary care here, the position, I had like 2 options, and they're like, hey, there's this neurology clinic. And I was like, I am not a neurology specialist, guys. Like, are you sure? And it was actually mainly because a lot of our patients use cannabis, and I had to get them off of cannabis in order for us to test their cognition or their thinking. And they're like, we treat all different kind of disease states. And they're like, as long as you can like talk to patients and treat multiple disease states, like we can teach you the traumatic brain injury side of it, because there is no in undergrad, like in pharmacy school, there's no like TBI class that you'll take. You'll take some neurology classes. So once I took this job, I became a certified brain injury specialist. I just kind of took a diver deep, and that's what's kind of cool is as a pharmacist, you're like, okay, I have this background knowledge, I'm a little rusty on it, and now I need to kind of brush up. So there's certificates that you can get. And now I love it. So, and I still treat a lot of different disease states. So I treat a lot of headaches and migraines. I treat a lot of psych, so PTSD, anxiety, hypervigilance. I treat insomnia is a big one, and nightmares. Nightmares, again, is a very niche thing that I didn't know much about, and now I know a ton about it. And I'm actually doing research on it in cannabis, which is really fascinating. So yeah, so it kind of fell into my lap, honestly. But again, I think that's what's so neat about being a pharmacist, is that you're able to kind of pivot to different things. Now, I will say, if I was in community and I wanted to pivot to hospital, that is a little bit more difficult, because usually you have to do a residency in, a hospital. But hospital did not interest me at all. I was like, I like my patients walking and talking to me, and I want to be able to have a relationship with them. So I knew I was always going to be kind of in the outpatient world. So I think as long as you're like, once you figure it out, when you're in pharmacy school, you have lots of hours in the hospital and in the community setting, you'll kind of figure out like, okay, hey, where do I want to go? It's not impossible to switch from community to hospital or vice versa. It's just, as you go on through your career, it just becomes a little more difficult.
Thank you so much.
Yeah.
Yes,
Another,
question.
yeah.
How, for switching, Dr. Switch, how does Florida support distance and non-traditional student academically and personally monitoring, touring, wellness, such as sports?
Yeah. So I just want to make sure I understand the question. How does CU support, is it non-traditional?
Yes.
Yes. So no, you may have to jump in on this a little bit for the non-traditional paths. I'll let you answer that, and then I can answer some of the supports that we have.
I mean, the I guess the norm is to be unnormal in terms of prospective students and students starting the program, is that we have so many different paths to becoming a pharmacist, that we have many students that are just 47 credit hours of college, and then they come here as a 21-year-old. We have people with degrees already, or graduate degrees, or late career changers. So we have many different student populations that are coming. So we treat them all with the support that they need. We have a great student support staff of advisors, tutors, career services, experiential rotation office that helps students with their placement. So we have a great staff here to help and support students throughout their journey. So in terms of non-traditional versus traditional, we view it all that everyone will have success in the program if you seek out the support that you need. So that's kind of that side of it.
Thank you.
Yes.
And we also have the remote path. So students who are, and I don't know the exact rules, so don't quote me on this. A lot of students who live out of state but are unable to attend here in person, or if you're in Colorado, there's a certain mileage distance that you have to be a remote student. But what that means is you attend classes as if you were in person, but you're on Zoom like this. So there are a lot of different options, depending on where you're at and your lifestyle and things like that. But yes, I've had students who are a lot younger than me, and then I've had students who are a lot older than me who, you know, this is their second or third career as well. Also, in your first year, you get matched up with a professor. So we call it student liaison groups. So I have like 2 first-year students, 2 second-year students, 2 third-year students, and 2 fourth-year students. And we meet about quarterly to just kind of check in. I'm there to support you with any questions that you have. And then it's also nice because the, you know, fourth-year students can help the first and second-year students. And so it's a good little, another kind of community and support system that you have as well, which is awesome. And then I think one other thing I don't think we mentioned enough is we have a really great library. And I know it sounds really cheesy and nerdy, but it's like right here on campus. And I mean, first off, it's beautiful. But second off, the librarians are on a medical campus. So even when I'm writing a paper and I'm like, I want to make sure that my literature review, that I'm not missing anything, like they'll double check me. They'll help me out. Or if you don't know how to start a research project, or you have questions on, you know, how to find papers and things like that, they are such a good resource. I think that's pretty unique to our campus because a lot of campuses may be attached to like an undergrad. So CU Anschutz we have like, there's the Boulder campus, there's the downtown campus, and we're the medical campus. So literally the librarians serve like all the medical students, nursing, PT, RN, like dental. So again, I feel just like they have a different mindset over here because they're always working with like medical professionals, which is really nice too. What other questions?
Hi, so for someone who's interested in cosmeceuticals, are there options to specialize in dermatology?
So good question. So there's not like a specific track or anything like that we have. You do take a couple dermatology courses in your pharmacotherapy courses. We also have compounding classes as well, as the derm world is a lot of formulation. And then I would imagine, I know there used to be a couple dermatology rotations that you could do as well. So in your 4th year, if you're interested in that, we can make sure to set you up with either a pharmacist who's compounding a lot of topical medications, or match you up with a company that may be doing more derm work.
Thank you.
Good question.
Hi. I had a question about, I wanted to know if you could go into more detail about your cannabis specialization and like what that certificate process looked like, as well as like how, what does the education look like for areas like herbalism, or for maybe patients who want to stay away from quote unquote like Western medicine?
All right, good question. So, so the cannabis question is, I again became a cannabis expert by accident. So when I went to pharmacy school, that's when medical cannabis became legal here. So we had pharmacotherapy. So pharmacotherapy courses, when I say that, those are like your main drug courses on like the therapies that we use. So think of like disease states. So we'll have like a cardiac where you'll do hypertension, so high blood pressure, high cholesterol, and things like that. And so we had a handful of drug courses on that. And then when I left, I quickly just kind of incorporated it into my patient education because so many of our patients were using cannabis. And then I did a specialty certificate. I'd have to look if it even exists anymore. But our school now offers a cannabis certificate. It is we didn't offer it this fall. I don't know when they're going to offer it again. I think there's an online option too. I'll have to double check that. But it is I want to say it's a 8 week course where anyone can take it. So you don't have to be a pharmacist, but we also offer it to our students as an elective. So they get to go through the whole process as well. So we bring in different pharmacists. So I come in and speak they have them watch like a couple hours of videos, and then we come in and talk about that. So we have, from the plant to formulations to different disease states. So you kind of get a good foundation of cannabis and you get a certificate from that. And then, again, I just kind of started talking to a lot of my patients about it. And then when I was in the Midwest, so I moved to St. Louis, the 2 pharmacy schools out there weren't really teaching any cannabis at the time. And so I ended up creating a consulting company because so many people are asking me questions. And then when I moved into academia, I created all the cannabis pharmacotherapy courses at that school. And then when I moved here, a lot of my patients use cannabis. And so just learning more and more about it, what patients are using. And then actually I published a textbook this year. I co-authored a textbook on cannabis. So when you're a student, you have access to our pharmacy library. And so you can access it free through there. So again, there's a lot of different avenues that you can, learn about cannabis. Through our school, we do have a mandatory, I believe it's at least a 2-hour course that every student has to take. And then again, if you want to take a deeper dive, you can take that elective and definitely, become a good cannabis expert after taking that class. And then to answer your second question about like herbalism, we don't really have any of that here. Most pharmacy schools don't. So we do teach like Western medicine, evidence-based medicine. We go off of guidelines, what are, the American Academy of, diabetes, we do ACOG, so that's where all the women's health is. So again, we go off of guidelines of what those recommendations are. We do have an alternative medication required class, so complementary and alternative medication course. I believe again it's a 2-hour course that's required, and then we do have a full elective as well, so a semester-long course where you can learn more about supplements, vitamins, and more of that nature. But we do train in our first year all of our students how to properly look up like vitamins and supplements and doses and look up studies and evaluate like, hey, is this, vitamin or supplement okay or safe to take with their other medications. A lot of my patients love to take a million vitamins and supplements because they hate taking medications. And so I'm constantly looking up like, what are the drug interactions? Like, is this worsening their depression? You'd be surprised how many over-the-counter supplements can worsen or exacerbate certain disease states. So you do get a good exposure to that, but there is not like a specialized, I would say like degree or anything that we have, but you do get a lot of exposure to it.
Okay, thank you.
Yeah, great question.
Can you guys hear me now?
Yep,
Yeah.
thanks.
Yes. Okay. First of all, I guess before I ask my question, I just wanted to say thank you to Dr. Schwander for taking the time Like I really do appreciate it. It really means a lot that you're taking the time to answer our questions. And second, I guess I'll ask my question now. So you did talk about how you work for like a clinic that I guess deals with like mild to moderate like cases. And like usually it's like a 3-week program and you work with like different healthcare professionals. So like what's your role in that? Like what is it like, what's like a typical day for you? Like what is your interactions with the patient? What does that look like?
Yeah, great question. So they're here for 3 days for an evaluation and they come back for their 3 weeks. So I see all of the evaluation patients that come in for an hour. So I meet with them one-on-one in the doctor's office, and I have an MA who like takes their blood pressure and stuff, which is nice. A lot of our pharmacy fellows and residents, I make them take the blood pressure too. I can't take blood pressure, but it saves me time. So they come in, get checked in, just like a doctor's office. I sit down with them and I go over all of their medications, their supplements, substances. So, alcohol, cannabis, nicotine, now psychedelics, because everyone's using psychedelics. So I have to go over that. And then I go over kind of their top symptoms. So some of my patients say, my headaches or migraines are really bothering me, or it's the PTSD, or I have insomnia, or it's all of them, or hormone dysregulation. And so then I kind of, interview them and say, hey, like what's going on here? And then I go over solutions like, hey, these are, I looked through your charts and I didn't see that you've tried this type of medication. Let's talk about it. So after I have that whole education session with the patients, like I said, it's an hour long. The next day I round with the team. So for every patient, we spend 30 minutes discussing with the team. So that's so all of us will give like a, 1 to 2 minute report being like, hey, this is what I found, which is great because then, the neuropsychologist may be like, hey, they don't have bipolar, even though someone previously may have diagnosed them with bipolar, which is actually pretty common. So, and that helps me because I may pick a different medication to treat the patient. So the rounds are really unique because most rounds you don't get to spend 30 minutes on a patient. And it's cool to hear, what the physical therapist picked up versus the neurologist versus the, art therapist. So we sit around, talk about, hey, this is our recommendation. And then we solidify like a treatment plan. So based on someone's report that may change a medication I recommend or take off, for example. And so then once we're done with that, then we put a report together and they get a discharge summary saying, hey, this is our recommendations. So because our patients are all over the United States, I actually don't prescribe medication here. Because they're only with us for 3 weeks. And then if they leave and we have a hard time following up, they're followed up for a year, but from a prescription standpoint, I'm licensed in Colorado. So we make recommendations to their primary care doctors, which 90% of the time they always take them. Now, when I was in primary care, so those are my patients that I see, for diabetes, on a monthly basis. I have a contract with a provider, so I can pull labs, I can prescribe medication. I'm acting pretty much as a physician in that setting. So a lot of our providers, they're in an ambulatory care is what we call it. So like a clinic setting, and we have authority to prescribe here, which is pretty cool. You can do lots of really neat things. And even in the community setting in Colorado, we have these things called statewide protocols. So we are allowed to prescribe without a provider hormonal contraception, HIV, PrEP and prophylaxis, smoking cessation, statins, medication for opioid use disorder. I think I'm missing a couple. But in Colorado, we're considered providers, so we are able to prescribe in the community pharmacy setting. So despite what setting you're in, you can do lots of cool things. Now, if you're in another state, it just kind of depends on the state. Most pharmacists still can prescribe. It may just look a little different, meaning like, okay, in this setting, you may have to have a contract with a provider saying you can prescribe under their name. Where in Colorado, we're providers, so we can prescribe under our own name, if that makes sense. But yeah, hopefully that answers your question.
That does answer my question. So I found that pretty interesting. So like I didn't even realize that in Colorado that pharmacists can actually prescribe. But I guess if what I'm hearing is correct, you're basically saying that collaboration is very key in what you're doing, like especially in like different like healthcare professionals, they can make sure that if there's like some mistake that you're getting caught on that, like, and making sure that the patient's getting the correct medication at the right time.
Yeah, exactly. Yeah, and like I said, in any setting, you know, I'm really lucky that I'm in a setting where the doctor's like 2 doors down from me. So if I have a question, I can just boop, boop, knock on their door. In a community setting, it may be a little more difficult. You may have to pick up the phone and call the provider, but you're still collaborating with lots of different healthcare providers. In the hospital, same situation. You're working with a lot of nurses, a lot of different providers, interns. So I think no matter what type of pharmacy what path you want to go down, you'll always be working on lots of different teams and we all kind of help each other out. So we make sure that the providers are, doing, the picking the best options. And, as pharmacists, we are the medication experts. And so we pick up a lot of these little caveats, that may not be picked up elsewhere. Like, for example, I had a patient who was prescribed an antidepressant for their anxiety, but they were also having nightmares. And this one medication had like a 15% adverse effect of like more vivid dreams. And like no one picked it up because again, it's such a nuanced little side effect. But I was like, let's just try it. Let's just get rid of this med to see what happens. And his nightmares went away. So again, that's why it's so important to, have a pharmacist on the team who knows the medications really well and knows some of these nuances that may not be picked up by other teammates.
Thanks so much.
Questions?
I have 2 questions, if that's all right. My first question is, how much is the program based on the molecular scale, like pharmacokinetics? Is there any involvement in like nanoscience and nanotechnology? Because I know that that's huge and up and coming right now in healthcare. And how much is like big picture, like here's how, like the disease states, here's what we prescribe for this situation, here's how to look at the correction. So I'm just wondering like what the difference is between like how much of it is like the molecular level and how much of it is just a bigger picture. And then my second question is about like the application requirements, because I know that a lot of programs are like they want a 3.0 GPA minimum, which totally makes sense. And this is kind of unique to me, but I started college at 15. I did 2 years at Red Rocks, got a really good GPA, went to Mines, have an okay GPA because Mines GPA is, it's deflated because they don't make it easy. So I was just wondering, like, what is the nuance on some of the requirements? Is it like hard limits, just kind of like what that looks like.
Yeah, great question. So I don't know like the percentage. I think we can maybe, I didn't even know, maybe do we have like a handout on like the different classes that we offer are online? I'm sure we do. But we definitely have like the basic sciences. So pharmacokinetics, which is at least 1 semester, if not 2 semesters. We have, and obviously there's requirements to come in. So biomedical stuff. And so we do have a lot of that foundational, because again, it's really hard to understand how medications work if you don't have that in the first year, and it is sprinkled throughout. So when we do disease states, so a lot of times we'll have someone to come in from like more of this. So we have the department of like, clinical pharmacy. So more of us who are practicing, and then we have the department of like pharmaceutical sciences, so like the scientists. So a lot of times they will teach part of the class, so they'll teach the molecular part and like these are what the drugs do, this is the pathophysiology, and then we will come in and say, okay, so these are the symptoms we see, these are the medications that we use, these are the side effects that we see. So I do think it's a good balance of both. I, again, don't know the percentage, don't quote me on it, but I'm sure we can get you a something with all the classes listed out, and you can kind of see where they're located throughout the curriculum as well. And then the second question for requirements, I'll probably have maybe Noah tap onto that. But I will say when it comes to, when we look at applications and GPAs and, there's not going to be like a hard, at least again, no, correct me if cut me off if I'm saying this incorrectly, but there's no
You're
like
right.
hard. like we understand that some schools are harder than others, and GPAs, it's really hard to say, hey, an apple here is an orange over there. Like, it doesn't work out. And so we look at the classes that you took, the leadership roles that you had. Those all play a huge role into that. Were you working when you were in school? And that plays, it all impacts it. So again, if you don't have the highest GPA, don't let that deter you. Because we do look at the full picture. We don't look at like, Christine, she got a C- in this one class, like she's not in. So again, it's think of big picture. And again, school of mines, we know that's a hard school. So we're not, we would be dismissing ourselves if we didn't take a second look at some of those grades that may not be the best grades per se.
Thank you.
Do you have anything else to add, Noah?
No, you nailed it. I put some I put stuff in the chat, and then you basically said what I said in the chat. So yeah, there's no hard cutoff. And so if you're below a 3.0, we still we're still going to look at your application, and we won't disqualify you based on that right away.
Awesome. Thank you so much.
All right, I have a two-part question. So I guess let's start with the good side first. What's like the most rewarding part of your job as a neurology pharmacist? And then second part, I feel like every job has like those tedious tasks. What are the tedious tasks that you have to deal with?
I'd say the most rewarding part is, from my patient side, I was just watching my patients progress and watching their symptoms being treated. Especially in the world that I'm in, I'm treating veterans, and, almost every single one of them like sits down and they're like, I've never sat down with a pharmacist for an hour and was able to ask all these questions about my medications. I mean, half of them don't even know what they're taking and why. So just explaining like, hey, this is why you're taking this, or hey, how long have you been on this? Like, do we really need to be taking this still? So just watching them and answering the questions and helping them was really neat. And then because I do specialize in cannabis, and I'm slowly becoming an expert in psychedelics, because a lot of our patients are dabbling in psychedelics. I had a patient yesterday an older gentleman who was having a lot of issues and was asking a lot about ketamine treatments. And we ended up calling his wife and putting her in the room with us on the phone, because she was like, this is the first time I've ever heard a provider like sit down and actually have a normal conversation versus like, oh, that's voodoo. Like we're not going to talk about that. So I think having those conversations, real conversations with our patients is, really rewarding, which is cool. And then with my students, I get to train students from their first year past graduation. And so it's really neat to see them, in their first year. And then I teach a lot in the third year. And then if they do a residency with me or a fellowship, how far they've progressed. So that's pretty cool too. And just see where our students end up. It's always like rewarding. Even my cannabis master students, they're not PharmD students, but they will, send me a message a couple of years later, being like, oh my gosh, I got this job. So it's fun to hear where everyone ends up. Now the not so fun parts of my job, I would say, it's hard because I'm always doing something different, which is great. But some of the teaching administration stuff, just like anything, grading papers sometimes takes longer, some of the administration work, things like that. But there's very few things that in my job that I don't like to do. So that's a hard one to answer.
I guess to add on top of that, so I worked as a technician at like a community pharmacy for like about a year. And the worst part for me was like dealing with insurance. Do you have to deal with insurance too?
Luckily, I don't anymore have to deal with insurance. I do have to fight like to bill. I actually teach the billing class and had a bill, so I'm really nerdy when it comes to that, because I want to make sure that we get paid for our services. I will say, even in the community setting, you'll always have to deal with insurance, or even in primary care when I was prescribing medications and it would get kicked back. That's probably, not ideal. But what's nice though in the pharmacy world that especially we're in a clinic setting, we can say, hey, I know this isn't going to get approved first, so we're going to try these 3 other medications first. before we try this medication. So having that simple education in the community side, in the pharmacy side, because then you as a technician can even call and say, hey, this is why it's not getting covered. Let me call your doctor and try to switch it to something else. So yeah, it's not the glamorous part of healthcare, but you're gonna have to deal with that if you're a MD, NP, PT, pretty much anything. So
Yeah, good point.
is there some questions in the chat that I need to answer?
Yeah, so Ahmed had some questions about IPPs and rotations, especially for just for the remote program. And I'm not sure associated with any college nearby in Minnesota. I don't think we have any affiliate colleges or anything like that.
No, so yeah, if you do the remote program, we don't have affiliations. I know for finding like appy rotations and things like that, there's a certain amount you have to do in Colorado, and then they can help you set up sites in your home state. So I'm sure we've had students from, where do you say?
Minnesota.
Yeah. And so as the remote program keeps growing, by the time you all are doing rotations, like you'll have lots of options.
Yeah, and a good rule of thumb for people considering remote is that the IPPs, so during the first 3 years, there are some smaller rotations, and we can try to set up something wherever you are. Every state is going to be different, every location is going to be different, so nothing's guaranteed, but we can work with you on that. Then, just like Dr. Schwander was saying, that 4th year, there are 7 rotations. 4 of those need to be in Colorado. 3 of them are your electives, and again, we can try to work with you on it being in your state or even international rotations. So that's kind of how those are set up.
Thank you so much.
You're welcome.
Yeah, we have a Guatemala rotation. We have more international rotations, but one of my residents is even going for a week in Guatemala to precept some of the students, which will be cool.
That seems to be a popular one. I hear a lot of people with the connections to the Guatemala. I know I've heard New Zealand quite a bit.
Yeah, the Guatemala one, we started it with, I want to say with the med school or something. So it's a cool program that we have it well established. So I think that's why a lot of our students go there.
Okay, so we are running up on the 45 minutes. Anyone have one final question?
What's your favorite thing about hand shoes?
Yeah, great question. I think it is the resources that we have at our fingertips. Where I don't know if you have looked at our campus, for those of you maybe who are not from Colorado, we're on a huge medical campus. So we have 3 hospitals on campus. We have the VA, Children's, and UCH. We have my clinic is actually on campus, which is really nice. So I can just like walk over to my clinic. But what's nice about it is if I'm like, so me and a neurologist are doing a research project together. She has all of her resources from the medical school. I have all my resources from the pharmacy school. Again, it's just all these opportunities that probably, if I was in a more isolated university, or if you're, when you're looking at pharmacy schools, that is really important. If you're looking at a pharmacy school, and again, I'm not saying it's bad if you're just like on an undergraduate, campus, but your resources may be more limited compared to a large medical campus where, again, you kind of you can collaborate with a lot more people, and you just have more technology kind of at your fingertips, again, that I normally probably would have not had if I was at a different university. And I think our students obviously get the benefit of that as well, because you get to shadow us in lots of different locations. If you want to work in the lab, you can work in the lab. If you want to be involved in research, you can be involved in research. So there's a lot of different ways to get involved because the professors are doing a lot of really cool things here.
Thank you so much.
Great, thank you. And so first of all, thank you, Dr. Schwander, for giving us your time and your expertise. Very insightful. So thank you very much. And thank you for everyone for attending. That was, I would say that was probably one of the best groups with the best questions. So very good job. Thank you for attending and participating. And like I said, be on the lookout for an email from us. And we are here for you throughout this whole journey. So if you have any questions for us, just don't hesitate to reach out and let us know. So again, thank you everyone for attending. Have a great weekend.
Yes, and if I can just say one thing
Okay.
too, if you have any follow-up questions, you can just Google my name and get my email. It's just my name at ucinstitutes.edu. So feel free. And I always have students who are hesitant, like, oh, I don't think I'm ready to apply this year. I'm just going to apply next year. I always tell them, just apply. The worst thing that can happen is you don't get in and you can get in next year. But I find students, when they wait and they apply the next year, they're like, man, I probably would have gone in the year before. I'm like, yes, you would have. So I always encourage students, even if you feel like you're unprepared, just apply, because again, that's a whole nother year that you're missing out on in your career later on. So again, don't be hesitant to reach out to us if you have any questions moving forward. And thank you for coming. I really appreciate it.